Good afternoon, everyone. Welcome to Let's Talk COVID. Do we know how many? We have 47 attendees, and I'm guessing by the time I'm done, we will probably have twice as many.
Right.
Let me give some opening remarks to get us started. First, thank you for staying steady on the course. So far, our approach to COVID, which is vaccinations and masks, is working. We have not had the level of infections that the general public has been having, but generally speaking, in DC, which is aggressive on managing the pandemic, things seem to be getting better. So I'm hoping that we're starting to see light at the end of the tunnel, but for now, it's still vaccinations and masks. Second, I just want to remind you all that Founders Day is next week. We have a couple of big shots coming. The mayor is the keynote speaker, Mayor Muriel Bowser. You know, it's budget season, so we want you to come and make sure we not only support the university and enjoy Founders Day, but also let her know that you know, she should continue to invest in the public institution of higher learning in and for the nation's capital, which is your University of the District of Columbia. Also on the 19th, we're going to be naming the student athlete complex for E.B. Henderson, who, as you know, is an alum of one of our predecessor institutions. And we're raising money to not only renovate the sports complex, but also to raise scholarship funds for the student athletes, and also to build a statue of E.B. Henderson in the new sports complex so that UDC become a destination for tourists from all over the world. E.B. Henderson is the grandfather of black basketball in America, and you know, if there wasn't any black basketball, there wouldn't be any basketball at all. Let's see now. We have test kits. Dr. Giller will bring you up to speed, but we're going to have a lot of self-test kits for you to take home. She'll tell you how we're going to introduce them and distribute them around to campus to anyone who needs them. We should have enough to go around to last a while. And we want people to use them because at the end of the day, it's all about individual responsibility, taking care of yourself, taking care of the people you love, and doing what's necessary to be responsible for yourselves and others around you. Alex, unless there's something else you want me to touch, I think that is what my list was for today.
Well, thank you, President Mason. I'll go ahead with the next slide, and what I want to do is just go over, as always, the institutional statistics and positive cases at the university, and then I want to talk about where the district is right now from a couple of different perspectives. And finally, I'll review some COVID protocols and some changes that we've made, and go from there. So, as you can see on the left side table, the good news that we have to report this town hall is that the cases are dropping substantially. We've had a total of 83 combined staff and faculty positive COVID cases and 54 student cases. I do think that, as I said in the last town hall, that the student cases are most likely underreported, or they go unreported. In some cases, it's difficult getting the final clearance test results and things like that for the students. But we have a pretty tight hold on the staff and faculty case management. And as you can see, in the last 3 weeks, we've dropped from what were pretty much double digits down to single digits, and actually 5 or below over the last 3 weeks. And so that's a pretty good trend. It goes very much along the lines of what's happening in the district. If you look on the right side of the slide, you'll see that and the weekly and daily case rates in the district, this is for the district as a whole, cases have dropped to 1/10 of what they were a month ago. And so that's a very positive trend. It looks as if perhaps this wave of Omicron has passed through the district and is subsiding. Also from this table, you can see that uh, the District Department of Health, DC Health, has sort of caught up on their backlog of contact tracing case management. Of course, when they had 10 times as many cases, they were having a hard time reaching out to people within a reasonable time period, but they're back up to over 90%, interviewing and contacting people within a 24 to 48 hour time period. And lastly, you can see that the fully vaccinated population in the district is still hovering about 67, 68%, and that seems to be where it's kind of stuck right now. Next slide, please. I hope everybody can see this. This is just some total case counts in the district. Again, by in the upper left, it's by age group, where you can see that I thought it was interesting that 68% of the total positive cases in the district are people under 40. And then when you get people above 40, in the 40 to 50, and the 50 to 60 age group, it's roughly 10 to 12% of the total cases. So you can see the young people are testing positive from COVID. Down at the bottom table, you can see that, as we've heard in the past, that nearly half of the positive cases in the district are listed as Black or African American, and we've talked about that in the past. Seems to be a trend that's widely prevalent across the United States. And then on the right side, I thought it was interesting to note that you know, as you might expect with what I just said, wards 5, 7, and 8 are certainly where the highest number of positive cases are geographically here in the district. And so, and here is the lightest ward is Ward 3, where we're at right now. The next slide. Earlier this week, I just want to mention, because it's been brought up to me, that the CDC released some updated information for higher education. This is not for K through 12, this is just for higher ed. And essentially, the take-home messages are the things that I've listed right here, and it's essentially what we're already doing. I imagine that a lot of college campuses are maybe more anxious than we are to take their masks off, or maybe there's a little bit more booster hesitancy. I'm not sure, but the CDC guidance stresses to promote vaccination and booster programs, to enforce the consistent and correct mask use. They suggest that masks be worn at all times indoors, which is currently what we're doing, and even outdoors for people who might be immunocompromised, for those who are not up to date on their boosters. They recommend testing for high-risk groups and screening events. We held one screening event on campus here last year, and we may do another. But we are testing high-risk groups. We're just testing folks in the law schools, both students and staff, faculty. We're still testing our student athletes, students and residents, and of course, we're doing weekly testing for individuals that have the approved exemptions from vaccination. I want to stress that we want to remind people to stay off campus if you're symptomatic. And that, of course, means scratchy throat, you got a runny nose, you're feeling feverish, any of those things. And there's a whole list of symptoms associated with COVID. But even if you don't have COVID, we don't want anybody to be on campus if they're feeling symptomatic, feeling ill. Again, these are CDC higher ed recommendations, and so they do recommend contact tracing and reinforcement of hand washing practices, both of which we're doing here. So the bottom line is that this new guidance came out, and we're already following right along the lines of what the CDC recommends. Next slide. As always, I want to review the COVID-19 protocols for what happens if you test positive, right? Whether or not you test positive on campus here, or if you are notified from another source where you've tested. Please send a notification to COVID Confidential. I think that's spelled correctly this time, at udc.edu, and report your test result in one form or another, whether it's a screenshot or the actual lab results as an attachment. If it's a home test or if it's a rapid test, please write your name and date on the front of the test. You can take a snapshot of it and attach that, send it in. Also provide your telephone number, your email address where you can be reached, and the date you were last on campus. And something new, I'm asking people to indicate their state where they live in the DMV. And that's just a question that keeps coming back from DC Health when they're doing their contact tracing. They've asked that we try to get that information and provide it with our initial notification to them. Following your initial submission to COVID Confidential, someone, possibly me, will reply to you within 24 hours with some additional information and further instructions. At UDC, we've decided, the COVID-19 task force has decided that we want to continue to recommend a 10-day isolation period. We understand that the CDC and even the district have come out with guidance that allows for shorter isolation periods, but we don't want anybody to be in a hurry to get back if they've been sick with COVID-19. And we've found through our own testing program that people that even at day 10 or after day 10 are still testing positive for COVID-19. And we're not going to make a determination based on that whether or not they're still infectious, but we definitely don't want to bring people back at day 5, right? And again, as always, we're still requiring a negative COVID-19 clearance test in order for you to be officially cleared to come back to campus. And so in previous meetings, we've emphasized that we would like this to be a PCR test, but the COVID-19 task force recently discussed and decided that either a PCR or antigen rapid test result, negative test result, is acceptable for getting cleared to return to campus. We just want people, we just don't want to place a burden, an excessive burden on individuals who may be sick, but they're ready to return. And so we feel, after reviewing information and other recommendations, that we feel this is a good move to make. I do believe that might be my last slide. If anybody has questions, please put them in the chat box and we'll start getting, well, that's not my last slide. I'm sorry. Here we go. So let's just talk about the campus testing update. So most people may know that we're doing testing at 4225 Connecticut Avenue, across the street from main campus. We're testing high-risk groups right now, and I mentioned the groups already. We're law school students and faculty, because they are on campus almost every day because they're full-time. We're testing student athletes, the students and residents, people with exemptions, and we may be testing others as well. There is testing only Tuesdays through Thursdays. And so the hours are listed there. If you are not a person in one of the mandatory weekly test groups, you can still go there and to be tested during those hours, but you should call ahead of time and make an appointment. If you do test positive, of course, you're not going to be able to stay on campus, and you should begin your isolation period immediately. You should leave, make arrangements to leave as quickly as possible. Go home and seek advice from your medical provider. Lastly, I just want to say that there are at-home test kits. There are rapid test kits and PCR test kits available through the district at multiple locations at libraries and fire stations across the district. And so if you want to get some kits for yourself to have at home for yourselves or for your families and loved ones, please visit that website there, coronavirus.dc.gov/testing. And you can go and pick those kits up at those locations. Again, as I was saying before, if anybody has questions regarding this information, please put it in the chat box, or else you can email me directly and I'll respond. I'll put my email in the chat before the end of this session. Now, with that said, I think I'll turn it over to Dr. Potter for an academic
Thank
affair.
you very much, Mr. Baiko. Just a couple of updates. I know that and hope that everyone is happy about the good news of the declining numbers of cases that the university has had. And so happy to hear the good news, but also just want to kind of celebrate students, faculty, and staff for adhering to mostly the protocols and policies that the institution has put in place for the very safety of everyone. A couple of things that we will share this afternoon. Hybrid and in-person classes will continue to be a foci as we plan forward with scheduling for summer and spring and fall of next year. We are currently looking at a number of scenarios and we'll be working with the Center for the Advancement of Learning, where our Blackboard platform is managed and housed, to really think about deploying brief surveys to students to kind of get a sense of how have their classes worked for them in the existing modes, while at the same time foreshadowing and forecasting what might be of need for students so that we can best plan for the future. We don't know what the future of COVID will hold, but we need to be in the best position to deliver courses without interruption. And so the hybrid, the high flex, the in-person, and the online modes of operation in terms of delivery will continue. President Mason did mention Founders Day. I'll just reiterate that on February 17th, not only will we have Mayor Bowser here speaking and Congresswoman Eleanor Holmes Norton receiving an award, but there are a number of students, faculty, and staff across the institution who will be recognized for their hard work, dedication, and commitment to the institution. And we would very much appreciate you coming to celebrate those award recipients in their moment of glory. I'd also say here that reservations are required. So if you go to the website, the RSVP is there. And as part of our policy and protocol, vaccinations and masks will be required. The audience capacity will be capped at 350 because we are very cognizant that we want to ensure physical distancing between seats in the space. And so people may be turned away if, in fact, they have not registered. So please register. You'll get your Eventbrite response, and we'll look to see you next Thursday. Spring break is coming up, March 7th through the 11th, and I'm sure that that is a recess that most people are looking forward to. We also want to highlight Research Week. A year ago, we began a collaborative effort to include all academic colleges and schools and extension programs, both at the undergraduate and graduate level, to celebrate research across the organization. And so we look forward to the speakers that are lined up. We look forward to the visibility. Last year, we had over 600 participants, viewers who were engaged in our virtual research week, and we hope to continue the growth and sharing of the expertise from our students and our faculty. Commencement will be in person on May 14th, provided that COVID allows us to assemble and there is no shutdown in the district. The announcement will be going out soon from Student Development and Success. I think Ms. Melinda Jennings has been hosting monthly meetings for those who are eligible for graduation. The application for the registrars through the registrar's office has closed for spring commencement. And I know that they are in the process of moving those application requests forward. So students, make sure that your audits are complete. Make sure you're meeting with your advisors, because you will have to have completed all requirements in order to participate in the spring 2022 commencement. We have a number of registration sessions that are forthcoming. Summer 1, April 1st through May 15th will be the registration dates. For Summer 2, April 1 through June 29th. And for fall registration, this is for continuing students, not new students, but continuing students, April 1st through August 21st. You will be able to begin the registration process. Those are all of the updates we have for academic affairs.
Thank you, Dr. Potter. I believe Vice President Sullivan is next with an update from the Office of Human Resources.
Thank you, Alex. Good afternoon, Firebirds. It is always a pleasure to have the opportunity to share information with our community. So today I have just a few updates about our vaccination mandate, pandemic leave, and a wellness opportunity for our employees. As you know, we do require the COVID-19 booster shot for all of our employees. To date, about 360 employees have uploaded their documentation in the Student Health Portal. Starting tomorrow, those employees whose dates of vaccination are such that they are eligible and should have uploaded, you will be receiving notices from the Office of Human Resources. Our employee exemption numbers have not changed, and we still encourage all of our exemption employees to ensure they are testing weekly. Those requirements are still in place, and your results must be uploaded according to the instructions provided earlier. I'd like to share with you that the university is offering 80 hours of paid personal pandemic leave for employees who have tested positive and who are unable to telework or work. There is a benefit maximum of 80 hours, and the employee must submit proof of a positive test to COVID Confidential. Once that has been done, COVID Confidential will contact the Office of Human Resources, and instructions will be provided on how the employee can request personal pandemic leave. If, for instance, an employee's absence or isolation period needs to be longer than the 80 hours provided, they may extend their time by using any other accrued leave that they have available. We know that a lot of people have questions about leave, so we still encourage everyone to contact Ms. Trina Bruce, our UDC leave coordinator. Her information is on the website as well as listed in the PowerPoint. And so I would like to echo Dr. Potter's comments and thank everyone for adhering to our protocols that really ensure the safety and well-being of our community. But I'd like to segue and really talk about well-being. And so I'd like to invite AVP Nicole Cradle to talk about a benefit that's available to employees.
Good afternoon, Firebirds. I hope everyone is having an awesome week thus far. As we mentioned last town hall, we launched the Headspace Wellness app on January the 18th, and we're excited to see so many employees that have taken advantage of this tool and registering and becoming members of Headspace and utilizing the resources that it's available to you and your family. So this is just a wellness check-in. Consider this moment to just feel to check in with yourself to see how are you doing regarding your wellness and your well-being as we are navigating the workforce. So just be mindful of the emails that are coming out. We've sent out communication regarding Headspace. What is Headspace? But then also on February the 23rd, we'll also be scheduling a live webinar where you can talk to myself and one of our benefit specialists about the navigation of Headspace app, where you can use it, how you can register. So this is another opportunity for a wellness check-in. So I'm excited. We're all excited, as wellness is the top priority for all of us in this day and age. So I'm hoping that everyone take advantage of this opportunity and this resource and tool. If you have any questions regarding Headspace, you can email us directly at headspace@udc.edu, and we will be proactively responding to your email requests to get you the resources that you need. It's always wonderful talking to you all, and hope you enjoy the rest of your afternoon.
Hi, good afternoon, everyone. So I'm going to just bring an update about our COVID testing. Alex went through some of this about the test site, 4225, the hours and whatnot. If you need an appointment outside of these times for whatever reason, you can call health services and you can schedule an appointment to test with them. But when you do test at 4225, you do have to check in almost like you would do at your doctor's office. And the check-in link is available at the RISE website. And there are also QR codes posted all around the test site where you can use your phone and register through the QR code on site. You can actually register as early as 24 hours prior to going to get tested. No appointment is necessary at the test site. But if you register ahead of time, like if you register on Monday and you don't want to go test until Wednesday, your registration will not still be in the system and you'd have to register again. It's a very quick process to register and check in, but it is our way of monitoring and ascertaining primarily who's being compliant with the mandatory testing if you're in one of the mandatory test groups. One of the other things I wanted to clarify with the testing update is the distinction between COVID confidential and compliance testing. I know a lot of people, because of the abundance of test kits in the district, both the antigen test kits and the PCR test kits, a lot of people are just testing at home and don't necessarily need to come to the test site to do that. If you have your own test results that you want to upload, you would actually do that through the 4225 check-in portal. You would not send those test results to COVID confidential. And we apologize if there's been some confusion about that because some members of our mandatory test groups have been uploading their test results to COVID confidential for compliance purposes. But COVID confidential is really our positive test case management tool. It's also there if you have questions and whatnot about COVID. But really with respect to test results, the only test results that should be uploaded to COVID confidential are test results pertaining to a positive test result and you're notifying the institution, or your clearance test result for you to return. If you are a member of a mandatory testing group and you simply want to upload your test result to be compliant with your weekly testing, you can do that through the check-in portal. That link is on the RISE website. I'll actually work with Jay to get it more prominent because right now it's kind of embedded in the information about 4225. So maybe we'll have a link that you click on and it would just say, I need to upload test results, okay? And then the other thing, we just found out yesterday, as President Mason mentioned, that we are getting an inventory of rapid test kits, the at-home rapid test kits from the district. And we have not had a chance to discuss this at the COVID task force, but we will do that. So be on the lookout for information about how to access these test kits. We will probably make them more readily available to our mandatory testing groups, including the law school, student athletes, residents, and whatnot. But we will reserve a portion of the test kits that you will probably be able to go to 4225 and pick up one, say once a week or something like that, so you can have them available. On the side, you can, of this slide, that is the portion of the 4225 check-in survey where you are able to upload. That is what it looks like. So it would ask what, you're here for compliance testing. What kind of test do you expect to take? I'm uploading a negative test result. And you can actually just upload the picture of the test result as you would with at COVID Confidential. So be on the lookout for information about those test kits, how we will be distributing them, and how this will ultimately impact our testing protocols, particularly for the mandatory test groups. And I think this is for Chief Latham.
Good afternoon, everyone. And again, to the Firebird family, we appreciate the work and support you guys have provided to our students over the course of this semester. It's been critical to their success, and we really recognize and want to say thank you to all staff and faculty who've been a part of the overall effort to really help strengthen our overall enrollment process, but also strengthen their student experience even during COVID. So I want to thank you guys for that. Spring registration numbers you see before you here, a total of 3,211 students. That represents about 13% decline from last spring, and that results from two particular factors. One is the vaccine mandate, and the other is just having the online modality that we had for majority of our classes in the fall left some of our freshman students vulnerable to that particular academic challenge. And so they didn't perform as well as we'd like for them to in the fall. So we're going to address that through support services on our end this semester and reach out to them and make sure we can stay and keep them supported over the course of this semester, and then make sure that they have the support academically outside the classroom, of course, to help support them in whatever need they may have, from tutoring to writing to any type of mentorship, even to get them prepared for the fall semester. So we recognize those two particular issues as a part of our enrollment strategy going forward for the university, and certainly SDS and the rest of the teams across academic affairs, in great collaboration with Dr. Potter and his team to help us really get there, support students in this very critical time of the pandemic, and really make sure they continue to be successful at UDC. You see there 1940 were students who were registered for at least one in-person class. 1271 of the students were 100% remote for this semester. We had 90 students who initially were dropped for in-person sections due to lack of having an active COVID hold or having an active COVID hold. 49 of those 90 were reinstated, and 41 remained dropped because they did not get that vaccination uploaded. So that's kind of where we stand right now overall for spring 22. But again, for this fall, we have good news around the fact that applications are up. We have, in fact, first time in college is up 20% for the fall in terms of applications. Admitted students are up over 100% for the fall semester as compared to last fall. And then confirmations are up over 300%. So we feel that we're trending in the right direction, of course, to make sure that we provide through our own ongoing work with Blackboard, the ongoing call center we have for students here, as well as the coaching apparatus we have through Blackboard to support their enrollment process and the application process being completed, that we're going to go hard to make sure we hit our target goals for the fall in terms of enrollment and rebound from this drop that we've had due to COVID and the vaccination mandate. So feel good about where we're headed as a campus and where we're headed as enrollment staff. We added additional staff as well to enrollment services over the course of this semester, additional recruiters, assistant director to support the director we hired in the fall of this past year. And so that's kind of what we're doing to make sure that we have proactive teams in place, proactive staff in place, and then make sure that we have the type of goals that we think are going to be realistic for us to hit for the fall. Also talking about fall numbers, we're going to work with the deans, as President Mason had mentioned before, around the Dawn initiative and the $2 million that was given to the university, as you may recall, to help them be able to really shape a class for their respective colleges in the fall through that scholarship initiative that each dean has access to and support through the president's granting of that money to the deans to support scholarship in each college. So very excited about that piece and what that's going to represent for the university and for each college to be able to shape a class through its own scholarship apparatus. So excited to see that, excited to work with them to get that done. And we'll continue to have that work help us again to buttress these numbers for the fall semester. Next slide. CARE support, as you know, we've given substantial support, over $17 million in the last 20 months to students through CARE support directly, whether that be direct student support, tuition, or support financially to cover related expenses, housing, food, transportation. We've started the tuition disbursement of CARES already, roughly about 2 weeks ago for students. We'll have the direct non-tuition support kick off in 2 weeks for students there to support non-tuition related expenses. We've covered books again this semester for all students at the university through the Fall All Access program, as we did in the fall. And of course, we still have those types of services and wraparound services from a technology standpoint, like the laptop loaner program that we have that's been able to support students from a technology perspective as well. We encourage staff and faculty to continue to help support, obviously, the wellness pieces of our support system here through our counseling center, making sure students have access to the online portal to help support the counseling work that they do there in the counseling center, and making sure students know about that, as well as a hotline they can have call and make sure their issues are addressed through our student hotline. So we want to be comprehensive across the board with making sure students understand that not only do we provide direct financial support to them, but we have other support services that are available to them. And many of them are 24/7 now to be able to support students being able to maintain their matriculation to the University of the District of Columbia. As you see there, we'll obviously go through that process of Pell Grant recipient tuition assistance there. Spring graduate assistance is being provided already for the spring graduates, and then direct student payments, I mentioned, will begin in a couple of weeks, really late February, for students to make sure they can have access to get tuition covered for this semester and be able to register, Dr. Pollard mentioned, beginning April 1 for continuing students for the fall semester and summer sessions. Next slide. Again, so I guess it's really for turning back over to Monique. Any questions you guys may have regarding students or any issues you may have, please put them in the chat for me to address or my team to address. And again, thank you for your work and your continued support of our students.
So Alex, do you want to take questions now?
Sure. And when we held our last town hall, we had a very vibrant and active discussion in the chat. There were several hundreds of chat messages back and forth that we couldn't even get to all the questions. So I was hoping that we maybe leave enough time in this town hall for something that might happen that was similar. But I don't see many questions. I don't see many comments in the chat. But if anybody does have a question they'd like to share, or if any of the panelists would like to add anything at this point, please do so. I guess we don't see any, I don't see anything. We'll leave it open for maybe a couple of minutes. Perhaps President Mason has something he'd like to share.
Only that I think the lack of questions is a testament to the thoroughness of the work of the committee and the fact that we've been consistent in our messaging. And so I see it as a big positive that all the questions were answered before they were asked, Alex. So congratulations to you guys in the committee. With that, I'm real comfortable with signing off, so I'll see folks later.
Okay.
And I just wanted to offer a clarification for everyone. One of the questions that came to me through COVID Confidential was about the testing at 4225. And I know last semester we had socialized our testing process as the cheek swab and whatnot. And that was for the PCR testing that we were temporarily running. The testing that is being offered at 4225 is a rapid antigen test, and it is the nasal swab. We also have 2 certified police officers who are certified to administer the test, who have been helping us. So there was also a question about why am I being tested by police officers? During COVID, we've been fortunate to have enlisted the assistance of lots of people who, are trained and in relevant cases certified to do this. So we want to thank the staffing at 4225 for their support. It's a pretty consistent staff. So if you're over there at any point, Ms. Monica Price Thomas from the Office of the President is kind of our boots on the ground administrator there. So if you go there, certainly thank them for their assistance and support.
Well, we did get a question, a last minute question asking why the booster is being mandated. If DC isn't mandating that in general to be labeled as fully vaccinated. I will share a response and perhaps somebody else can add in, but DC Health has sort of changed their terminology so that instead of calling people fully vaccinated, they're saying up to date with your vaccinations. And so that does mean that you're fully boosted and according to whatever the booster recommendations are at that time. And that's what we're requiring at the university.
Alex, I would just add to that the dates of when the original shots and when they're eligible to take their boosters are being taken into consideration. So.
Okay. Well, that was it. I think we've got one question. I'm glad we got to address that. I think the president's already signed us off. And so please be safe. Please pay attention to the next town hall and join in if you can. All right. Be well, everyone.